Good afternoon, and thank you for joining me today. My name is Will Williams, and I am a first-year junior faculty at Ochsner Health in New Orleans. I appreciate the opportunity to speak to you all today, and I'm hopeful that the next few minutes will be useful, both for those at various stages of OBGYN and MFM training, as well as for their mentors. We have a couple goals for today's talk. First, understanding the essential role for approaching global health in an ethical context. I'm hoping to briefly cover an ethical framework for trainees. Doing this in any detail would be a lecture to itself, so my goal is really to identify some resources that may be helpful for both trainees and their mentors as they think through experiences in global health. Second, I'm going to survey global health experiences available to folks at various levels of training. The survey will by no means be comprehensive, and I'm going to include some stops on my personal story to help provide a little color commentary. The reason I have the privilege of presenting today is that I had the good fortune of being selected for the 2018 Queenan Fellowship for Global Health. I had the pleasure of joining Dr. Pitts as one of the two awardees that year. I submitted a grant proposal that was a touch outside the realm of classic maternal fetal medicine research. However, I had some excellent mentorship, and the Foundation for SMFM was both lenient and generous. So we'll talk a bit more about that project in a little bit. One of the biggest considerations in pursuing global health opportunities is doing so in an ethical manner. Doing anything across cultures and languages is incredibly complex. As physicians, we bind ourselves to the ethical considerations of justice, autonomy, beneficence, and non-maleficence. Despite our good intentions, true non-maleficence in a new environment can be almost impossible. When we add in our own biases, assumptions, and ignorance, we have real potential to do harm. Thankfully, a lot of smart people from a wide array of backgrounds have come together to help build frameworks for ethics in global health. This is a really useful one. Matthew 𝗘𝗏 has written prolifically in this area, helping to author the American College of Physicians position paper on ethical obligations regarding short-term global health experiences. While specifically targeting short-term clinical experiences, the positions laid out can be helpful as we think through an array of global health opportunities for trainees. The position paper focuses on the traveler's intention, as well as the cultural baggage that we bring as Westerners traveling from high-resource settings to new locations. I encourage you to pull the reference and add it to your global health experience file. It includes case vignettes to help guide thinking through possible ethical conflicts that can arise. To quickly run through the positions. Position number 1. Physicians' primary ethical obligation in short-term global health experiences is to improve the health and well-being of the individuals and communities they visit. This seems intuitive. Most clinicians, at least consciously, are approaching their trips with the intention of helping. However, the historic view that something is better than nothing does not meet criteria for actual benefit. This standard is reflected in both best practice guidelines and current literature. Essential to establishing the primary obligation of beneficence is that each community served actually wants the intervention. Additionally, functioning within one's appropriate scope of practice is critical. For trainees in particular, a temptation can arise to participate in procedures they've not been appropriately trained for in the name of limited resources. This simply cannot be. Position number 2. The ethical principle of justice requires partnering with local leaders to ensure that potential burdens participants can place on local communities abroad are minimized. Preparing for resource limitations is essential, particularly coming from a medical system that often assumes that more is more. Building equitable partnerships with local leaders is critical to minimizing collateral damage that we might cause. Position 3. The ethical principle of respect for persons, including being sensitive to and respectful of cultural differences, is essential to short-term global medical experiences. While respect for persons may seem like a no-brainer, opportunities are ripe for insensitivity. Cultural sensitivity respects individual and community choice, privacy, and truth-telling. In addition to cultural competence, a physician must also demonstrate cultural humility, a virtue that is not well incubated in a country that prides itself on American exceptionalism. Position 4. Pre-departure preparation is itself an ethical obligation. It should incorporate preparation for logistical and ethical challenges of short-term experiences, including the potential for ethical challenges and moral distress. There are a number of resources available to help with this prep, and most established groups that provide short-term experiences have some formalized curriculum that offers both pre-departure preparation and post-departure briefings. For a start, I recommend reviewing the resources cited in this position paper. As I mentioned before, the short vignettes here offer a nice start. The paper has links to online modules and in-print documents. Finally, Position 5. Physicians should participate with organizations whose short-term experiences are consistent with the ethics and professionalism exemplified in these positions. As many of you in attendance today have shown, cultivating and sustaining long-standing relationships is critical to doing well. For adventurous residents or medical students, there may be an appeal to cutting one's own path to tailor an experience precisely to what one is hoping for. Sacrificing some preferences for the sake of functioning within an established program is likely the better choice. In my experiences, I've certainly fallen short of all 5 of these principles. I presume many of us have. Additionally, a wise mentor has pointed out that the degree to which some of these obligations can be met necessarily depends on the privileges of the person pursuing an opportunity. A first-year medical student might not have the luxury of choosing from several different organizations when looking for a summer experience. Or they may be in an institution that does not have an established, formalized program. Conversely, a funded clinical investigator pursuing a relationship with a partnering institution is going to have a bit more agency. The good news is that we walk by falling. That's at least according to this 2014 paper by Wang and Srinivasan. In each step forward, we are correcting countless tiny falls. Failures are inevitable, but this brings us back to the humility referenced in the position paper. A willingness to acknowledge shortcomings and ignorance, paired with a desire to learn from those with whom we are working, is the foundation of successful global health training experiences. My hope is that this will be true for trainees following the path outlined in the following slides. Now I'm going to talk a bit about my experiences in global health through each stage of my training, while hopefully providing a survey of opportunities for trainees at that junction. Step 1. Medical school. According to my entirely fabricated research, mentions of or references to global health are present in 90% of medical school application personal statements. Please do not quote me on that. It is not based in fact, but it feels true. To look at some real data, according to a 2015 𝗙𝗎𝗶 New Student Questionnaire, 36% of matriculating medical students had participated in international volunteer experiences. Many students come through the door with some exposure already under their belt. According to the 𝗙𝗎𝗶 graduation questionnaire from 2019, 25 to 30% of students participate in either elective or volunteer global health experiences during medical school. If you circulate in the realm of academic medicine in any capacity, questions or conversations about global health are going to come up, particularly for the self-selected group listening to this talk. And that's great, at least by my estimation, because I was that medical student not so very long ago, and you are exactly the kind of folks I was hoping to talk to. There's enough interest in global health among medical students that people are actually publishing manuscripts about it. This paper from 2013 surveyed 96 medical schools and found that medical student international experience during medical school had increased from about 6% in 1984 to 23% in 2007. 90% of institutions reported offering global health opportunities for students. The majority of schools had active global health interest groups. For those plugged into undergraduate medical education, these data already feel outdated. The most recent data from the 𝗲𝗶𝗶𝗵 reports that by 2015, 31% of graduates had some type of global health experience during their medical school training. The doors are open wide for students to gain experience in global health. These are available at almost every institution, and they exist at both allopathic and osteopathic programs. Many universities have begun to offer global health tracks or joint degrees that incorporate global health experiences. Most institutions offer programs at least that involve short-term experiences, often somewhere between 2 and 12 weeks. They're generally targeted towards specific timing. So for some, that's between the first and second year of medical school. Others offer programs during the fourth year. These programs vary in structure and in objectives, and many of them build on the experiences of prior students. Importantly, most schools have formalized pre-departure programs as well as debriefings at the time of return. The ethics of global health experiences are becoming a formalized part of these programs. Medical school is where I gained my first meaningful exposure to public health. UAB continues to offer the Medical Student Enrichment Program, which hasn't changed all that much since I went through 13 years ago. This funded summer opportunity opened the door for me to go to Cusco, Peru for a couple months following my first year of medical school. While this program was fresh at the time, I think I may have been in the second or third class to go through, most medical schools have a pretty similar opportunity established by now. I spent those months in Cusco shadowing in a primary care clinic and immersed in Spanish as well as a little bit of 𝗕𝗲𝗄. As is the case for many students, my personal experience was wildly different from whatever expectations I might have had. The trip nuanced my thinking not only about medical care, but also social structures, the allocation of resources, and the importance of checking my assumptions at the door when stepping into a new environment. The project opened my mind to really begin exploring what sustainable global health work might look like. I saw the importance of working within an integrated health system to optimize patient care. Most importantly, I realized that the skills I was building as a physician in training would be terribly insufficient to make a meaningful difference in a complex health setting. I left the trip inspired to augment my medical schooling with public health training. When I returned to Birmingham, I enrolled in UAB's MD and PH program, extending medical training by a year while seeking to develop some public health literacy. For students interested in longer-term experiences, there are a number of funded options through federal programs. These include the traditional Fulbright U.S. student program and the Fogarty International program. Additionally, there's a combined Fulbright Fogarty Fellowship in Public Health. These programs are open to those in pre-doctoral or pre-professional programs as well as postdocs. Each fund a 12-month project in global or public health, and these are typically on the ground in an international location. Applicants apply directly to Fulbright, but for Fulbright Fogarty or for the Fogarty sites, you apply directly to the consortia sites, and those sites can be found on the NIH website. These are competitive, and I can attest to that personally as I was rejected by no fewer than 2 of the above programs. But that brings me to an essential point. For trainees looking for global health exposure, be willing to put yourself out there and be willing to fail. Even through failed applications, I established connections that have been meaningful and productive for years down the road. I will point out at the urging of the University of North Carolina Fulbright Fogarty Site Director 𝗵𝗁 that these are not limited to current medical students. These are programs that one can enter as a postdoc, and I believe that's even post-residency, though you may want to check with the sites before submitting an application as you've completed residency. A number of NGOs have focused training programs that function analogous to the Fogarty type model. These typically involve a 12-month commitment with a focused area of research or programming. Again, these programs are generally open to doctoral or pre-professional students and postdocs. As I mentioned, when I returned from Cusco, I enrolled in the MD and PH program at UAB. Between my third and fourth year of medical school, I went through an accelerated public health degree. During that time, I began looking for opportunities to apply my knowledge in a real-world setting, and I applied to the HIV Core Program through the Center for Infectious Disease Research in Zambia. Extending my medical schooling by another year, I moved to Lusaka, Zambia, where I first met Dr. Eli Stringer and the fantastic team they'd established. The HIV Core team was composed of medical students, recent MPH grads, and a PhD postdoc. We were each assigned to an established project and mentor, and we had a curriculum that featured research talks, journal clubs, and lessons in the local language. The project to which I was assigned was a health system strengthening study, where I quickly found a niche. Step 2, residency. Again, according to my entirely fabricated research, mentions of or references to global health are present in 86.3% of residency application personal statements. It isn't just medical schools that are providing global health experiences. 90% of OBGYN residency programs advertise some measure of global health experience on their program websites. Some countries boast as many as 20 training partnerships with US-based OBGYN residencies. Based on the structure of residency, these in-house programs are really the mainstay of resident global health experience, though away rotations can be coordinated for residents with specific interests or for those who do not have in-program opportunities. This experience matters to residents as well. While most residents do not engage in international experiences during their training, 99% of those who do report that they are likely to incorporate global health into future practice. Even for those not exposed to global health experience during residency, huge numbers of OBGYN residents say that they are either very or somewhat likely to incorporate global health into their future practice. Step 3A, post-residency. As folks wrap up residency, there are a number of options to pursue further experience and training in global health. There is a wide assortment of global women's health training programs that OBGYNs can enter after finishing residency. They vary greatly in objectives, format, and scope. Some are specifically targeted towards OBGYNs, while others will also take physicians from other specialties. Some afford clinical experience, while others are heavily research-focused. This is nowhere near a comprehensive list, and this landscape is perpetually changing based on funding and departmental priorities. A number of these programs have been established for years and have long-standing international relationships. There is no global health fellowship match, so applicants apply individually to each program. I know several of the programs interview in the fall for October or November decisions. Again, the Fogarty and Fulbright Fogarty Fellowships may be a possibility here. Another option that is not focused entirely on the international experience of global health is the CDC's Epidemic Intelligence Service. It equips physicians and PhDs with on-the-ground epidemiology training, often being deployed to outbreak sites. It's a paid 2-year program that can certainly open doors in the realm of global health. Physicians who pursue careers in the CDC rave about their experience in the EIS. I believe they have a spring application deadline for a start the summer of the next calendar year. Step 3B, MFM Fellowship. Not unlike residency, fellowships can offer a range of global health experiences. Again, these are typically program-specific. One of the coolest opportunities is the Queenan Fellowship for Global Health. The Foundation for SMFM offers a number of opportunities, and you've gotten to hear from some of the other awardees today. As I mentioned before, I was fortunate to have received the Queenan Fellowship for an investigator-initiated project. Without getting too far into the weeds, My project was a secondary analysis of a randomized controlled trial in Bangladesh looking at the efficacy of the Rotarix oral rotavirus vaccine. Infants in Bangladesh, as well as in many other low and middle income countries, don't garner equivalent protection to oral rotavirus vaccines compared to children in high income settings. This is remarkably unfortunate, as these kids are the ones at highest risk of death from diarrheal diseases. Lots of theories have been explored as to why this disparity exists, but major gaps remain in our understanding of not only the causes, but more importantly, how they can be addressed. My project looked at genetically determined maternal breast milk components as one of the potential contributors to the problem. To test the hypothesis, I needed to determine maternal FUT2 genotypes as well as breast milk enzyme phenotypes to correlate them with infant serologic response to the vaccine. The Queenan Award provided funding for this project, as well as connecting me to mentors that could help bring the project to fruition. We were able to show that our variable of interest, maternal secretor status, was associated with infant vaccine response. While prior studies had correlated infant secretor status to vaccine response, we found that the maternal status and its effect on the breast milk the infant consumed was more important than that of the child, answering an important question that had previously been unasked. The findings open the door for potential biological mechanisms for altered vaccine response and could prove important in next-generation rotavirus vaccine design and testing. The work generated both conference presentations and a journal article. I made my first foray into Poster 2.0, which you can see on the left side of your screen. Importantly, future lines of inquiry are currently underway to determine if our findings affect clinical response to the oral rotavirus vaccine. Finally, as all trainees know, we are only going to be as good as those who invest time in us. These are some of the folks who have invested in my pursuit of training in global health. I'm grateful for their time, their guidance, and the models that they have set before me. Finally, I'd like to provide an update as to what I'm doing currently. By day, I'm a junior faculty at Ochsner Health, learning the ropes of being a maternal fetal medicine specialist here in New Orleans. But my side hustle is with Imaging the World Africa, an NGO based in Uganda that is rolling out antenatal ultrasounds to rural clinics in Eastern Africa. My hope is that I can continue to build on the fantastic training opportunities I've had to help build a thoughtful, equitable, and sustainable program with ITW. I'm also hopeful that my experiences with the Global Health Consortium here at SMFM can provide insights and guidance into future directions. Thank you for your time, and I'm happy to take questions.